Good evening, everyone. How you all doing?
Doing well.
Great, great. Well, everyone that's joined us from Facebook and the internet and social media, just want to welcome you all tonight to our docs, our community. Just want to have a conversation with a number of awesome and outstanding physicians from both the Memphis and Nashville area. We have Dr. Lynetta Anderson, Dr. L.B. Washington, Dr. Erica Gunhill, and Dr. Stanley Thompson, who will be joining us later. He's on a flight and he's trying to get off of that flight right now. So they're all going to be with us tonight, and we're of course going to be talking about COVID-19 and COVID-19 vaccinations and the hesitancy that is a part of our community. As we all know, COVID is a pandemic that has stricken the entire world. It's claimed many millions of lives. There's many millions of cases, and it's claimed millions of lives as well. And what we want to do is make sure that our community is not being overlooked and not being so hesitant that we're not participating in the healthcare system that can actually be saving our lives. So we're going to talk about a lot of things that have been out here in the community, that I've seen in the community, that our physicians have seen in the community, and some of the myths that are out there and misinformation that's out there. We're going to answer those questions and correct it, but then also give you the facts. One of the things I tell everyone is that, we have a lot of feelings around our healthcare, but feelings are not facts. We need the facts, and that's what's going to help us be healthy, change, and of course, be safe during this pandemic and save some lives. So as I introduce each one of the doctors who are here right now, we're going to let them come in and give you an opening statement, some ideas that they have, some perspectives they have on COVID-19 and vaccinations. And then we're also going to move after that into answering some questions that we've gotten from the community about COVID-19 vaccinations. So first of all, I'm going to introduce Dr. Erica Gunhill. And Dr. Erica Gunhill grew up in Southern California. She's a proud graduate of Spelman College, where she received her BS in chemistry. She completed her medical degree at Morehouse College School of Medicine in Atlanta, Georgia. She then moved to Memphis in 1999 to complete her residency in family medicine at the University of Tennessee. Dr. Gunhill has a strong interest in preventive health, adolescent and women's health, and she's also a member of St. Andrew AME Church, where she coordinates their congregational first aid as well as their community health promotion and community youth empowerment events. She's currently at the Randall Family Healthcare Center in Bartlett. She was also recently honored by Memphis, the City Magazine, as a Memphis Top Doctor in 2019 and 2020, and the Memphis Flyer in 2021 as an exceptional woman in family medicine. So Dr. Erica Gunhill, if you could just wave at everybody for us, and then we're going to come back to you. Awesome. We have Dr. Lynetta Anderson, who is very special to my family because she delivered my baby girl, my youngest. She delivered Tia. She is amazing. Dr. Lynetta Anderson has practiced obstetrics and gynecology at the Women's Physician Group for the last 24 years. She's a native of Memphis. Dr. Anderson returned home from medical school at Johns Hopkins, which is in Baltimore, Maryland. And she also got an obstetrics and gynecology residency completed at Northwestern University. In addition to obstetrics and gynecology, her practice focus is expanding the option of minimally invasive and robotic surgery for women. She is also a strong supporter of natural labor for the low-risk obstetric patient, and she's been board certified since 1988. She served as president of the Bluff City Medical Association and board member for the Memphis Medical Society. She has also served as chairman of the peer review committee at Baptist Women's Hospital. Dr. Anderson, could you tell everybody hello?
Hi. It's a pleasure to be here.
Thank you so much. And we also have Dr. Latanya B. Washington. She is the current president of the Bluff City Medical Society, the premier organization for physicians of color in Memphis, in the Memphis metropolitan area. Dr. Washington is board certified in internal medicine and pediatrics, and currently the physician advisor at St. Francis Hospital. She received a bachelor's of science from Tougaloo College in Tougaloo, Mississippi, and doctorate of medicine at the University of Tennessee Health Science Center in Memphis, Tennessee. She completed a combined internal medicine and pediatrics residency at University of Arkansas for Medical Sciences, where she was chief resident her final year. She obtained a master's of business administration at Auburn University to enhance her training in the business aspects of medicine. Dr. Washington is passionate about bringing awareness to social injustices, identifying and improving health inequities through improving health literacy and healthcare access. She is currently serving on the Memphis and Shelby County Joint COVID-19 Task Force as well. Dr. Washington, could you please tell everyone hello?
Hi, everyone.
Excellent, excellent. And a lot of you already know me. I'm Dr. Ted Lyons. I'm a pharmacist. I've been an immunizing pharmacist for about 24 years, graduated from the University of Tennessee College of Pharmacy, undergraduate degree in chemistry from Jackson State University. So I love, and not right down the street from Tougaloo College in Jackson, Mississippi. So I've been practicing for, like I said, over 24 years. I've been part of the CDC's program, READY program, to actually help increase immunizations for influenza. Did that back in 2003, 2004. And a lot of what we learned in that program is what I'm trying to do now as we try to tackle COVID. What we have to do is make sure that we are giving information to our community from people that they trust. And that's the purpose of tonight. So if we would, please, we're going to go around the room and let each one of the physicians give you their view on COVID-19. And we can start with Dr. Anderson, if you will.
Well, good evening. It is certainly an honor to serve on such an esteemed group of panelists tonight. And we want to thank, first of all, Dr. Lyons and his amazing wife, Merica, for just creating this opportunity for the community, because that's really where we are now, moving forward, as we're now at compared to pre-vaccine and today, we're at a 10% new case level. And when we look at these new cases, it still scares me that I'm seeing it in people of color predominantly, and particularly when it comes to those lives that we're losing or those patients that are ending up in our intensive care units. It's still our family members, our cousins, our aunts, our friends, our coworkers. And so dealing with the vaccine hesitancy now is really a major issue. When access was limited, when we were only meting out the vaccine to people at certain ages and high risk factors, people were trying to make a decision about whether to get vaccinated, but many didn't even have the opportunity or the access. And now that it's readily available, the question becomes now, where do we stand as a community in trying to get past that 75th percentile of what we want to reach for herd immunity? So when I look at my patient population, obviously as a gynecologist, my main emphasis and experience is with pregnant patients and GYN patients. And it's been such a learning curve as a physician because, you know, physicians are naturally trained to look at the science. And the science is very clear. And so when we look at the science and the data is clear, we think the decision is pretty simple, right? Get vaccinated, it's going to help all of us. We're going to protect our family members. We're going to protect ourselves. We're going to protect strangers that we come in contact with, and eventually, hopefully, eradicate this pandemic. So then when we see that we're still at a stagnant 40% community-wide and even lower in the African-American and other minority communities, we still have a long way to go. And this long way to go even includes patients that have high risk factors, you know, the highest exposure in terms of our job positions in society, multi-generational home environments where if I don't get vaccinated and I'm vulnerable and I'm working these jobs where I'm out in the community coming in contact with, you know, all kinds of people at, you know, various risk and concern about protecting others, I'll say. And now that society is starting to open up again, the risk is going to increase for those unvaccinated. So it is imperative for the physicians serving those patients to number one, be seen and be on the forefront of trying to encourage those patients to get vaccinated, but just be a source of knowledge and counseling and presence, sharing the journey with these individuals, because I have seen patients in January say never, and then by March, after a couple of visits, they're getting vaccinated. So I know your voice and your role and the power of your position really does matter. So I just want to always be in the best position to counsel those patients appropriately and to learn from them, because once we understand where the hesitancy comes from, then we know how to address it, right?
Exactly. Exactly. I thank you so much, Dr. Washington.
Hi, first of all, I'd like to say thank you for this opportunity. I mean, certainly COVID has been at the front of everyone's mind for well over a year. I remember when I first heard about this COVID-19 back in the fall of 2019, and they were saying that there was a virus with pandemic potential that was happening in China. And I remember thinking, if this gets to the US, it is going to be bad. However, I did not know that it was going to be this bad. So that certainly is a major concern. COVID continues to be a concern. People are still dying every single day here in Memphis with COVID-19. And so it's very important that you all understand that, make sure that you're protecting yourselves and protecting your family. I know that everybody is tired of COVID, but COVID is not tired of us. So it's important that we continue to protect ourselves, continue to adhere to the masking. I was out today. I made a few stops before I got home from work, and I really didn't see anybody wearing masks. And that was very concerning to me. Of course, I have my mask on and people are looking at me like I'm crazy. Like, why do you still have on a mask? Because I still know that the threat is very real. And so if you're out and about and you're making the assumption that the people who are not wearing masks are vaccinated, that is essentially not true, because when you look at the number of individuals in a particular area who've received a vaccine, I was just looking, I get an email every day that tells me the number of people vaccinated in the country. So in the US, about half of Americans have received at least one dose of the COVID vaccine, and only 40% are fully vaccinated. So if you're in any place and more than 40% of people are not wearing masks, then you can bet money that most of those people have not been vaccinated. And so you're certainly increasing your risk. We've already talked a little bit, and I'm sure we will dive more deeply into how this disease affects persons of color more disproportionately than other people groups, and how it's very important that we have to protect ourselves. And so, we will share in that. I'm not really in the position to kind of shame people into getting the vaccine. I want you to have as much knowledge that you possibly can have, and so that you can make an educated decision about whether you want to receive the vaccine and whether you want to encourage other people to receive the vaccine. So again, thank you for allowing me to be here. I'm happy to share any information that I have.
Awesome. Thank you so much. And Dr. Gunhill, we also had Dr. Thompson, who's just joined us. And as soon as we finish with Dr. Gunhill, we're going to come right to you, Dr. Thompson.
Sounds good, Ted.
All right.
I thank you for allowing me to be a part of this wonderful panel of physicians who are doing a lot of work in the community to help close those healthcare gaps and those healthcare disparities. I just want to say, this pandemic is something that we've never seen in our lifetime. And we have to remember that this is novel, this is new. They call this the novel coronavirus because it is new. And because of that, we have to give each other grace. We have to give the scientists grace. We have to give each other grace. And realize that we are learning as we go. And because of that, sometimes information is confusing. Sometimes it's incomplete. Sometimes we have to change things, but that's a part of this process. And we need to realize that. But, the impact of this pandemic has been far reaching globally and as well as in our personal lives. It's affected us with personal illness, with tragic loss of family members. It's affected our finances and our emotions, our emotional state. As a physician, I feel like, I've been on a battlefield during this entire pandemic. And it's a battlefield that I've not been prepared to fight. And we're doing our best as physicians and as scientists to heal people, to prevent this illness from spreading to people, to educate people. But, we do need to make sure that we approach this in a holistic way with the vaccines, with treatments, with education, and with social outreach. And I think that if we can do that in a holistic way, we'll be successful in reaching the goals that we want to reach with this pandemic. As far as the community goes, just echoing, we do need to make sure we hold on to our mask because the virus is still out there, even though these mandates have been lifted. The virus is still out there. And, I've had several patients this week that have been reinfected with the virus. And, as Dr. Washington said, just because people are not wearing masks, it doesn't mean that they've been vaccinated. And so the fact that people are not wearing masks and they haven't been vaccinated means that if you're out there, your risk of getting the virus is much higher now. So just encourage you to be careful, to continue to take the precautions that are necessary. Thank you.
Thank you. Thank you so much, Dr. Gunhill. We have you all, Dr. Stanley Thompson, on the line as well now. He made it. Thank God you landed safely in New York, Stan. Stan's like a family member. Dr. Thompson, I had to keep calling him, remind myself to call him that because I've known him for about 30 years. He was at UT and Jackson State with me and everything. I was in pharmacy school and all that wonderful stuff. Only thing he did wrong was he pledged Kappa instead of Alpha, but we'll let him go with that.
Oh, that's good. That's good, Dr. Lyons. Yeah, I had to do the same. Can you hear me okay? Because I'm in the back of a cab.
I'm ready to introduce you for real though, so they'll know that you're not the average person walking. This is Dr. Stanley Thompson. He is the Chief Clinical Officer for Team Health LifePoint Group in Nashville, Tennessee. He oversees 61 contracts for emergency medicine. Dr. Thompson earned his medical degree from the University of Tennessee College of Medicine, his undergraduate degree from Jackson State University, his residency in emergency medicine he did at Emory University in Atlanta. He is also the past chief of staff at Baptist Hospital DeSoto in South Haven, Mississippi, and the physician chair of System ED Committee for Baptist Memorial Hospital. And he also serves as over the medical director for one of the DeSoto County paramedic associations, paramedic school, and about 4 ambulance services. He doesn't stop working, y'all. It's amazing. On top of all that, he's also a minister just like I am, and he is very active in his church and serves on the board of directors there as well. So you all, Dr. Stan Thompson, if you would, Stan, you can go ahead and give him your opening thoughts and perspective as well.
Thank you, Dr. Lyons. And I have to do the same thing. I have to remember not to call you Ted, folks, because like you said, we've known each other for 30 years. So I appreciate this opportunity to vaccine hesitancy. So it is just as real. As a practicing emergency physician, it saddened me to make some decisions during the height of the pandemic of admitting patients or unfortunately pronouncing patients without their family members present. This was a really rough time to be an emergency physician because people really sick with COVID, of course. The emergency department was the first place they would come. And so we had issues with getting patients admitted to the hospital because hospitals were full. Normal pathways for transferring patients in smaller hospitals were closed. And it was a really tough time. COVID was real. And the fact that it disproportionately affected people of color is a thing that probably hurt my heart on the most, to have to tell a Black daughter that her mom just passed away of COVID. And so, not trying to spread fear, but COVID is still out there. It is still real. And as the other great physicians on this panel, who I'm just proud to be amongst tonight, have already pointed out, with mask mandates coming off, and still in the state of Tennessee, only 38% of people have received at least one vaccine, with only 25% having received both. And you look at COVID rates in Shelby County, we're still leading the state in COVID rates. So we're still vulnerable. So like the doctor said, when you look around at people not wearing masks, no, there's not 90% of those folks vaccinated, and you think you're safe. So COVID is still real. It's still leading in Tennessee, and the vaccination. And I get it, y'all. I get it. We as African Americans, we have rightful reasons to be distrustful of the government and the House of Medicine. We have right. There have been things in the past, Tuskegee Institute, Tuskegee experiment, and other experiments, and then the lack of African American faces in randomized controlled trials of studies of medications, and that we have rights to be skeptical. But I every day in my job, I do risk versus benefit analysis, and I have to decide whether the risk outweighs the benefit. And in COVID vaccination, this one is clear. The benefits much outweigh the risk. The known risk of death, morbidity from COVID strongly, highly overweighs the risk of any side effects from the vaccination, especially into the unknown side effects. I'm a proud member of the COVID vaccination class of December 2019. And so I'm just asking. I know people don't know me from anybody, so it's a trust factor. Not trying to strong arm anybody, but just do your information, do your research, get real answers to questions, be able to separate fact from myth, and make an informed decision about getting vaccinated, because it could be a life-saving situation, not for just yourself, but for your family and your family members. And the whole thing about herd immunity, just to dispel that myth, you can't, people say, well, I'll wait till everybody else gets vaccinated to get herd immunity. Doesn't work that way. Herd immunity only counts in your community. So the people you work, live, shop, and be around, that's your herd. And so if everybody in your herd is not getting vaccinated, there will be no herd immunity for your herd. So just strongly consider getting the vaccination, do your research, do your homework, and make an informed decision.
And thank you so much, Dr. Thompson. And you all just touched on something, and we're going to bring it home to Tennessee. And let's talk about Tennessee. I know several of you work both in Mississippi and Arkansas as well. So our tri-state area, it is, when you look at the CDC maps, it's horrible. I mean, when you just look at even the vulnerability maps, we're the darkest of the blue, meaning that we are the most vulnerable population here in Shelby County. When you look at the community transmission maps, we're orange, and in some areas around Memphis, bright red, meaning that we are either substantially high or very high in transmission. And it's like, as you said, someone said earlier, you go out and you see people no mask on. You know that in Shelby County, we're only at about 25, 28% vaccinated. And in the African-American community, it's way lower. And if you really take out the seniors who are already vaccinated and look at the people who are out and about, that'll be your folks from 15 to about 55 years old that are out and about every day. Those numbers are even worse. So when we look at that, could you all just speak to the thoughts or ideas of, this doesn't really affect me. I can, roll the dice and not get vaccinated or not wear my mask right now.
Yeah, I'm happy to speak to that. We are seeing a number, most of our new cases of COVID are in the age group of under 55 years old. You talked about the seniors, and really that is the group that I think has had most success with the COVID vaccinations. Like if it were only a community of seniors, then they're good on the herd immunity, because about 70 to 80% of people over age 65 in this country have been fully vaccinated against COVID-19. Everyone else is really lagging behind. And so in our hospital, what we're seeing is those under age 55 are really the ones that are most vulnerable right now. We talk about people who have chronic conditions. We know that Memphis, this is the Bible Belt. A lot of us have extra pounds on board. A lot of people in this area have diabetes, high blood pressure. They may have COPD or asthma. They may smoke cigarettes. All of those things increase your risk for being more severely affected with COVID-19. And then when we talk about young people, I know there's been a lot of talk in the media recently about young folks. Very true that many of them don't get severely ill from COVID-19 infection, but they can still have long-term effects of COVID. They can still require hospitalization and can still die from COVID. I think in my hospital, the youngest person that we had in the hospital who died from COVID was in their mid-20s. Now that person had some other underlying medical conditions as well, but that's very young. We wouldn't have expected that to happen, based on what we're hearing in the news. So it's really important that young people understand that this disease can affect you. You can go home, you can affect people you love, your parents, your grandparents, other loved ones who are vulnerable, who maybe don't have access to be able to get the vaccine. So it's important that you remain socially responsible in caring for yourself and caring for your family.
And I wanted to add to that too, in speaking about Shelby County, I was looking at a website called covidactnow.org, and Shelby County is actually 99% more vulnerable than all of the US counties. And that's because we have low incomes here, high percentage of low incomes. We have housing and transportation challenges. We have a high percentage of minorities who have higher risk factors with diabetes and high blood pressure. Our population density is higher. There are issues with health access as well here. And then people are working and living in crowded spaces. There are a lot of people who work in distribution centers here. So our community itself is very vulnerable, not just because of, not just in comparison to other cities, but and not just because of our population, but the community itself is very vulnerable. So we need to keep that in mind in light of making sure that we get vaccinated.
Right. And that's so very true. It's one of the things I've talked to a couple of employer and employee groups about here, and a couple of large ones here in Memphis when I vaccinate their facilities. It's something I like to call illness integrity. So we lack that because we are a community who just grinds it out. We go out there, we keep working even when we're sick. We go to school even when we're sick. We go to play at clubs even when we're sick. And you don't tell people that you're ill. That's something else that adds to the vulnerability of our community. And when you look at those vulnerability maps, and like you said, we're 99%, we're in the 99th percentile. And on the CDC's map, we're in the top 10%, of counties that are at risk for COVID, and then a COVID disease infecting everyone, then it blowing up all across the county and infecting us. And then now our hospitals are at risk. Our ICUs are overloaded. With Dr. Thompson being in emergency medicine, I know you see it all too often that when they come in, there's nowhere to put them, especially at the height of the pandemic. There's nowhere to go for additional beds, and you need an ICU bed. Right now in Shelby County, I don't know what the numbers are, and Dr. Washington, you may know exactly what they are now as far as ICU beds are available, but I know a few weeks ago, they were still at that point where we don't have that many left if we were to have an explosion.
Yeah, so I'll speak to that a little bit. Before they were really doing a lot with counting the number of ICU beds, the number of ventilators, and we've really seen that kind of decrease. And so initially we were counting those beds to see how many beds we needed for COVID patients. Well, right now we have a good number of COVID patients, but then we have other patients who require ICU care as well. You know, patients who maybe had to have heart surgery or who may have sepsis or any other conditions. So we're still in that crunch for ICU beds, although it may not be all COVID patients. And a lot of our hospitals in the area, I know I can speak for Memphis in particular, they're still having those bed crunches. Patients are still having to board in the emergency department. I know Dr. Thompson can probably talk about that. And that's always a challenge because if you think about it, I mean, it is, we have to talk about throughput. So you can't get as many patients into the emergency department if there's nowhere to put them. You know, you may go to the hospital and to the emergency room, you may have to sit in the hallway to receive your care. Where you can imagine that, you know, we make every effort to identify those patients who have COVID and put them in a room away from others. But if there's no other space, then they may be in the hall. And so that's really a concern because we really want to make sure that all of our patients are really kept safe. We don't want to increase the number of COVID cases within the hospital setting just because they're exposed because we don't have a place to put those patients. So still ICU beds continue to be an issue. We still continue to monitor our resources on a daily basis. But as you can see by if you just turn on the news, I mean, they aren't really talking about COVID a whole lot right now. And so that's the main concern. You know, people are like out of sight, out of mind. Well, the truth is that this virus has always been out of sight, but it should not be out of mind. And it was more to the forefront of people's minds when there were, you know, on the news every day, they were reporting the number of new COVID cases, COVID deaths, and you could see that ticker with the number of cases going up, up, up each day. And so now we're not doing that. And so people are getting more comfortable. They're taking their mask off. They're doing more risky behaviors. And so that's a concern going forward.
Okay. And I don't know if we lost Dr. Thompson or not. If you're not out, if you're still on there, Dr. Thompson, you can chime in at any time. What I'm going to do is I'm going to go through some of the questions that we've gotten from the community. And as you all hear them, you can just respond to them as often as you want to, or if you want to wait till another one, that's fine as well. One of the first questions we have is, I'm afraid because they rushed this vaccine. How do we know that it's safe?
Well, I'll chime in there too. Can you hear me okay?
Yes, we can hear you.
I'm still kind of moving. Okay. So on the rush of the vaccine, really, truly, there was not I know it's hard to believe, but when you really, truly look at the development of this vaccine, and you look at the fact that we get a new flu vaccine every year. Every year there's a new variant of flu. We get a flu vaccine every year. So actually, it wasn't a rush. It was a rush to get the vaccine, but there were no shortcuts taken on the development of this vaccine. The development of this vaccine went through all the regulatory standards that you have to. Now, so we said, well, what was Operation Warp Speed then? What was then President Trump doing with his Operation Warp Speed? Well, what happened with Operation Warp Speed was three major things. It allowed pharmaceutical companies, it got some of the red tape out of the way so they wouldn't have to go through all the hoops. There were a lot of things that were done in parallel that normally have to go from this step to that step. It also provided a lot of the manufacturing and other things that you need to develop a vaccine. It cleared the path to make sure that those manufacturers put a priority on giving the supplies to the three vaccine companies. And it also gave money to the companies to develop the vaccine. The government didn't develop this vaccine. These vaccines were developed by Moderna, Pfizer, and Johnson & Johnson. So yeah, it did go fast, but it went faster because of the red tape getting moved and other things. It still went through all the regulatory steps that all vaccines go through to get approved.
Excellent, excellent. That is so very true. And one of those parallel steps that really made a big difference in the whole pharmaceutical process is that they started actually production at the same time they were going through all the other steps, and that really shortened the time. So it wasn't a rush, and you're exactly right on that. Another question that came in, and some of our OBs can answer this. It says, does the vaccine make women infertile or hurt our babies if we become pregnant and we've had a vaccination?
Those are great questions because, as most people know, during pregnancy, women have, nothing but the highest level of concern for the safety of their pregnancy, protecting their infants, and really trying to be the voice of reason for their families. So making the decision about whether or not to get vaccinated very often starts with the female leader in the family. So when we talk to our pregnant patients, those that are beyond their 12th week and less than their 36th week, so that they actually have time to get vaccinated, we strongly and highly encourage vaccination during the pregnancy. They will not only be less vulnerable, because the statistics have proven to us that pregnant women are 3 times as likely with an active infection to have an admission to an intensive care unit. So that number alone is important to the pregnant patient. And then getting vaccinated, not only are you protecting yourself, but you're also protecting your newborn infant, because producing immunity will be passively passed to the newborn infant through breastfeeding. So pregnant women have a unique opportunity and motivation during their pregnancy to actually get vaccinated. There were concerns about whether the targeted antibody, so your body actually producing that memory response, whether or not that would cause miscarriages in patients that were already pregnant. And pretty universally in the OBGYN community, we have recommended after 12 weeks to kind of allay that concern for administering the vaccine. But the vaccine, actually, we have data from 4 weeks, 5 weeks, 6 weeks, 7 weeks, 8 weeks, 9 weeks, 10 weeks that says it's very safe. And actually, in the initial trial of over 20,000 patients, the only miscarriage occurred in the placebo group. So I think the data, which we're monitoring separately, is ongoing and very clear that not only is it safe, but it's to the patient's advantage to be vaccinated even during the pregnancy. Another kind of gynecologic population that's very high risk are patients with a medical condition called polycystic ovarian syndrome. And these are patients who have basically a metabolism that mimics almost a diabetic patient. They have insulin resistance, they're typically morbidly obese, they have a spectrum of other symptoms where the cycles may be delayed, they have male pattern hair growth, so they may be the female with the mustache and beard, chest hair, very difficult to lose weight. So the morbid level of obesity is very high. The incidence of hypertensive disorders is very high. The compounding factors of respiratory problems complicate these patients' profiles. And when you look at this particular community, they are 52% higher, more likely to get an active COVID infection that requires intervention. So this is a particularly concerning group because these can be your 20-year-olds, your 25-year-olds, your 30-year-old patients that are seeing levels of infection that mimic those patients that are in the, as I'm getting older, 55 is not that old anymore, but in the age range above 60, I'll say, population. And so it's a little alarming that we look at those faces and they tend to look brown and like our family members. Right. So we owe a unique emphasis on trying to help those patients reach a level of maturity in their understanding of the illness and help them along the decision process to move more towards vaccination.
And another question, man, that's so excellent. I'm glad you pointed that out about the polycystic ovarian disease. There's another question that came in that's I guess, kind of right for our community. And Dr. Thompson kind of spoke this earlier. It says, is this a trick to track us or kill us as minorities? They've done stuff to us before. And then as an additional part of that question, why are they stressing that Black and brown people need to get vaccinated?
Yeah, we need to get vaccinated because we're the ones that are have the highest rate of mortality from this virus. We have the highest rate of underlying health conditions, the highest rates of diabetes and high blood pressure and sleep apnea and heart disease. So we, more than anybody else, need to seriously consider getting the vaccine. I was looking at the statistics on COVID in our community, and we are 1.1 times more likely to become infected, 3 times more likely to become hospitalized, and 2 times more likely to die from the virus. And yes, we do have a lot of health disparities. We have a long history of medical apartheid. We have a long history of experiments and things being done to us without our consent. But this is different because we have knowledge, we have the information, we are informed at this point. And we have millions of doses of vaccines that have gone into arms at this point, and we've got studies on those people, and we know that the safety profile is pretty high for the vaccine. But we also know that the chance of us having complications from COVID is very high. So just as Dr. Thompson said, you have to weigh the risk versus the benefits. And the risk of you winding up in the ICU and even dying from COVID are much higher than any side effects that you're going to possibly get from the vaccine.
I'll chime in there as well. We have heard all types of things about this vaccine, from implanting microchips to it changing your DNA. And so just to let everyone know that that is not the case. That is not true of this vaccine. It doesn't implant anything into your body. It doesn't cause anything. It only gives your body the framework to make an antibody against the spike protein that's on the virus, so that your body can recognize that, hey, this is something that's not supposed to be here, and fight it off. And I hear people talking about the Tuskegee experiment a lot, and I think a lot of people probably don't know exactly what happened with the Tuskegee experiment. And so I just want to go over that really quickly. They talk about Tuskegee. And so what Tuskegee is all of those patients that they studied in the Tuskegee experiment, they already had syphilis. Like, nobody gave those individuals syphilis. They had syphilis. Now, what they did wrong in the experiment was that when penicillin was found to be curative treatment for syphilis, they did not treat them. So that is wrong. Let us be clear about that. It was absolutely wrong. But they didn't inject anything into these men to cause them to have syphilis at all. And so when we relate that to COVID, it's completely different. People are getting spontaneously infected in the community with COVID. And what we are saying is we're offering this vaccine to individuals to protect you from getting COVID. Then when we talk about people who are getting the vaccine, when we look at the percentage of people who've gotten the vaccine, overwhelmingly, it has not been people of color who are in the highest percentage of people who've gotten the vaccine. I will also say that there is nothing genetically that makes me as a Black person different from a white person. So there's nothing that can be targeted in me to cause harm to me as a Black person that wouldn't cause harm to someone who is not a Black person or who is not a brown person. So that's just not genetically impossible. If you look at our DNA, it's completely the same between Black and white. I just have melanin, they don't have as much melanin. So, you know, just to kind of clear that up a bit, because it's really important. And so when we think about the number of people who were lining up, who was trying to get all of the vaccine appointments when the vaccines first became available. And so we have to think about that. Like, there's a reason for that. And if there's an opportunity where we can run to the front of the line to get vaccinated, then I would say in this instance, then that would be something that we should do. So that's been the push to make sure that Black and brown people were getting vaccinated against COVID, because we have the data that shows that we've been disproportionately affected by this disease. And so what they're talking about and pushing for more Black and brown folks to get the vaccine is a form of health equity, meaning that we're trying to level the playing field. If I can get an increased number of Black and brown folks vaccinated against COVID-19, then we're protecting that community and we're leveling the playing field, meaning that, you know, the people who are more disproportionately affected by chronic diseases don't get COVID, so they don't have to go into the hospital and suffer these negative outcomes.
Exactly.
Yeah,
Exactly. Go ahead.
I just want to chime in there because I want to make sure y'all heard what the good doctor said. Those conspiracy theories about genocide to African Americans from the COVID-19 vaccine, like I said, do your research, do your reading, but some of this is just common sense. So like she said, there's disparity in giving the vaccine. More white communities have received vaccine than Black communities. So if it was a conspiracy theory to kill Black folks, then that would not be the case. It would be the reverse. You'd see all the Black communities getting the vaccine and not the white communities. And like she said, there's no difference in our DNA, so they can't target anything else to kill us with the vaccine than they can with the white population. Secondly, common sense again. I know we have made some real technological advancements, but we don't have liquid electronics. We don't have those.
No.
So getting a liquid shot into your arm cannot confer any tracking ability at all. If you want to watch out for tracking, throw your cell phone in the garbage. Because if anybody's going to track you, that's the best way to track you, is your cell phone. But we know we're not going to do that because we got to have you on Instagram and Facebook and call June them. So you can forget that, but that's the way to track it. And like Dr. Watson said, I mean, there have been, over 100,000 people combined in the 3 studies. And that was not less than 25% of people of color in any of those studies. And there was no side effect profile that rang true in any African-American or people of color population versus the general population at all. So, and there, like she said, there have been 100 million people vaccinated at this point. Again, less than what we want, but still about 22% of those folks vaccinated have been people of color. So when you put those numbers together, you've had millions of people of color been vaccinated. There have been no signals, no signs for any increase in death, any increase in adverse reactions, or any increase, anything in that, in people of color getting the vaccine than people not of color getting the vaccine.
Exactly. Amazing. One of the questions that came in, that's a really good one. I think you all will be able to tackle. So it says, since there are variants out here and they're saying we need to get a booster shot anyway, why do I need to get vaccinated now? Why not just wait on the booster?
Okay, so I'll kind of take it back to just kind of some general principles of vaccinations. So when you say booster, that means one thing. So when we were kids and we got vaccines, most of us did, probably all of us did. So when you get your initial vaccine, it is introducing your body to that substance so that you can develop an immunity. And then you may have to get a booster shot. So what a booster shot does is it kind of gives you that re-up. It increases your level of immunity so that you're still fully protected. So that's why you don't need to wait for the booster because you need immunity now. You are at risk for COVID right now, today. And what we're really at the point right now is that we are kind of at a race against the variants. You know, right now, the vaccine is effectively covering people and protecting them against all of the known variants of COVID-19. However, the longer that this virus circulates in our community, the higher the risk of a variant or a mutation. That's what variant means. It's a mutation of the virus that won't be covered by this vaccine. And so then when we get to that point, then we're in trouble. And so then there'll be a rush to get a booster vaccine to help protect you even more. So you'll have the general immunity that you had from your first COVID vaccine series. And then if you have to get another booster shot, then that just helps to bump your antibody levels up in your body a little bit more to protect you even more from the COVID-19 virus.
All right. But then they say, I've had COVID-19 already and I'm good. I don't need a vaccination. What's the truth about that?
So
You're not good. That's the simple answer is you're not good. And the reason why is because we're not sure how long actually having COVID is protective against the disease. Because especially if you had a mild case, then you may not have developed antibodies during that first infection to fight off COVID for a second. That's why we're seeing people with reinfections. We know that the COVID vaccine, Moderna and Pfizer are over 90% effective, and Johnson & Johnson over 85% effective. We don't know, we can't give those numbers for being infected. So if you have had COVID, right now the recommendations is that you 90 days post-infection, or at least 14 to 90 days post-infection before you get the vaccine. But the vaccine is still recommended for those who have even had COVID.
And if we look at the population of Brazil, they didn't have the vaccine initially. So, probably 90% of their population got COVID. And then you looked later on when this new variant, this Brazilian variant came about, they all got reinfected. So that lets you know that a natural infection doesn't give you immunity for very long. So you want to get the vaccine. The vaccine gives you your immune system a chance to build immunity and keep that immunity for a longer period of time. And, as of right now, we've been studying these vaccines for a little over 6 months, 8 months now. And we see that the vaccinated patients still have those antibodies in their system. And anytime the virus moves from one person to another, it has an opportunity to mutate and change. So that is the point that's the purpose of us trying to get to the herd immunity, either from antibodies from the natural infection or antibodies from the vaccine. We want more people with those antibodies than people who don't have the antibodies. That way, the virus can't move to anybody. If the virus can't move to anybody, the virus dies. And so we're looking for 70 to 80% of people to have those antibodies in a community or in your own herd, as Dr. Stan mentioned.
That's excellent. And that was going to answer the last question I was going to ask about herd immunity, because that's a question that comes up a lot, but I think you addressed that quite well, Dr. Dunhill. If you all would just go around the room and each of you give a closing remark that you really want to leave the people with, and then we'll close out, and we'll start with Dr. Anderson.
First of all, I think there was some amazing information disseminated tonight. And I think that the most important aspect of that information is it's done out of love. The reason we're all here and spending our Friday night on a Zoom call, that we're all inundated with too many Zoom calls, is because we care about what's happening to our community. And our patients trust our faces a bit more in terms of what information they're going to actually process, take home to their families, and make the best decision they can make. So it's imperative for us to use our platforms to the best of our abilities to understand where they're coming from, to deal and address directly some of the myths and misinformation that's really pervasive, and some of the fears, and to acknowledge that that fear is based in some very sound life journeys and experiences that our community has been through. But we're at a new point. This is a new day. This is a new virus with very major implications for our community in particular. And we have an opportunity to make a difference as individuals, making the right decisions for our own health and the health of those in our many herds. And I think the concept of the mini herd could probably be a way that we can talk to our small communities and small groups and to really make the point. Look in your small herd. What is the percentage of people around you every day where you work, where you eat, where you sleep, where you socialize that are likely to be infected? I'm sorry, to be vaccinated. And when those numbers are small, you better have every precaution in place at every time and every day to protect yourself and those that you love. But to the community, I say that we're here for you. Use your physicians that are readily available to assist you in really having sound knowledge. Stop using the excuse that I'm going to do my own research, and just talk to us. We're here and we want the best for you and the best for our future generation. Thank you.
All right, thank you. Dr. Washington?
I definitely agree with everything Dr. Anderson said. As I mentioned before, COVID-19 is still a threat. I will give you guys just an experience that happened at my hospital this week. There was a patient who was in the hospital. He had been in the hospital a couple times this year, and I had cared for him before, and he came in and had COVID. This gentleman, he did okay. He was able to be discharged home. But one thing that was different was we tried to call his wife just to let her know that he would be being discharged from the hospital to go home. And we weren't able to get in contact with her. And so this gentleman went home. He did have some underlying conditions. And then we got a call from his daughter telling us, hey, he got discharged from the hospital, but his wife is in the ICU on the ventilator with COVID, and she would help care for him. So he was unable to care for himself at home. And then we learned on Monday that his wife had actually died from COVID. And this was someone that we had talked to about the vaccination. And he and his wife chose not to be immunized against COVID. And as a result, his wife has now passed away from COVID, and he, still has COVID, and is unable to care for himself at home. So now he has to go to a nursing home. So that's real life. That's here in Memphis. That's happened this week with someone that we know locally in the area. So understand that COVID is real. We're talking about this vaccine. We've been on numerous Zoom calls, doing speaking engagements really all across the country. Most of the time, we are not compensated for this work. We are doing it because we believe in what we're saying and we want our communities to be safe. And I will say that, if at this point you're still unclear about whether you want to receive the COVID vaccine, my question is, what is it that is keeping you from getting the COVID vaccine now? And if you have that question, I will say, reach out to me. I'm on all the social medias, the Facebook, Instagram, Twitter. Send me a message. I'll answer that question for you. And I will give you all the information that you need coming from a place of medical knowledge so that you can make that decision on your own. But if you choose not to be vaccinated, just understand that you will continue to be at risk well into 2022, 2023, and so on. COVID-19 isn't going anywhere. And we talk about the masking requirements. I'm still wearing my mask. I'm going to be wearing my mask really probably until 2022 at least. There are some places that I will never go unmasked again. In the hospital, you're not going to see me without a mask on in the hospital. In the winter months, you're not going to see me without a mask on. in the airport, you're not gonna see me without a mask on, just because there's such high risk for transmission of all kinds of viruses, not just COVID-19. So just understand that, like I said, reach out to me. I will respond to you. It might take me a little bit of time because I'm busy, but I'm happy to answer any questions of anyone that you know, any questions that you have, or from anyone that you know that may have questions about COVID.
Excellent. Thank you so much, Dr. Gunhill.
I just want to say that, again, we need to continue to take precautions, keep your mask nearby, keep it on. When we're looking at Australia right now, they had nearly eradicated COVID. And they this weekend are getting ready to go on lockdown again. So we have no idea what the future holds in Shelby County or anywhere in the United States as far as COVID is concerned. So we need to continue to take the precautions and just be mindful that this is something we're going to have to live with for a while. There are a lot of people that made the decision early that they were going to get the vaccine. Those people have already been vaccinated. Dr. Washington talked about the senior population. You know, they're like 80% vaccinated. But there are a lot of people right now who are still on the fence. And in my practice, I see that I'm able to move the needle as I educate people more. But I just want to say, if you're on the fence, get off the fence. Get the information you need, get off the fence, stop listening to the conspiracy theories, and get the facts. And go ahead and get your vaccine, because as we said earlier, you are more likely to die from COVID than from this vaccine. The vaccine is safe. The side effects that we're hearing, the problems that we're hearing are very rare, very rare. It's not a perfect vaccine, for sure. There are some rare cases of problems, but they are rare in comparison to your risk of having complications or dying from this disease. So get off of the fence, get the facts, keep your mask on.
Thank you so much. Dr. Thompson.
First of all, I want to just thank you, Dr. Lyons, for including me amongst these heavy hitters of African American physician women. Boy, I'm just proud to be amongst them. But so this has been great. This has been awesome. So I'll close out briefly. A virus's job is to survive and replicate. That's what it wants to do. It does not want to die. It wants to find it, and the only way it survives is by replication. And the only way it replicates is finding a vulnerable host. So knowing that we are the host, we have to do whatever we can to protect ourselves to keep that virus from replicating, because the virus, it doesn't care whether you survive, it kills you, whatever. It's just doing its job. Your dying is just a side effect of it's trying to do what it wants to do. And so we have to protect ourselves against this virus. And we have to continue, because we know as African Americans, we're vulnerable. We live in Shelby County, which has some of the highest vulnerability that we pointed out. So the odds are stacked against us to just naturally do what we want to do and not get the vaccine and not have any consequences from the virus. And you say, well, I don't have any comorbid disease. I'm young, I'm healthy. Yeah, but I bet you hang around some 55-year-olds who have diabetes and hypertension at your job, or that may be your parent or whoever. So you can walk around with COVID, be asymptomatic, and still transmit the disease. So if you don't want to do it for yourself, do it for your loved ones, do it for those that you are around that are still highly vulnerable. And for anything you can come up with about the reasons why not to take this vaccine, I guarantee you that, first of all, separate fact from fiction. Just take the myths out. And we've covered a lot of those. But even on the other things, even on the facts, so, well, you can have an adverse reaction. There have been some adverse reactions to this vaccine, and people have gotten allergic reactions and had bad allergic reactions. That's true. But the percentage of allergic reactions to this vaccine pales in comparison to just the percentage of reactions from antibiotic shots. So, well, I saw the nurse on the TV get Bell's palsy. You can get Bell's palsy from the disease, from the vaccine. No, not from the vaccine. And if you look at 100,000 people, and follow them over a period, there gonna be some people who get Bell's palsy because that's just the incident of Bell's palsy, period, whether they had a vaccine or not. So when you look at the placebo, it was just as many in that group that had Bell's palsy as well. So you have to know, stop just listening to the sound bites on the news and social media. Get the pure facts. And the pure fact is this vaccine is safe. And again, that risk versus benefit profile, when you look at the risk of contracting COVID-19 versus the risk of any side effects from the vaccine, the side effects from the vaccine pale in comparison to what can happen if you get COVID. So get vaccinated, people.
Excellent, excellent. I want to thank each and every one of you for agreeing to participate and participating on tonight. The information you gave is priceless, it's valuable. It is everything that our community needs. We need even more, but like you said, it's a Friday night and I know it's Memorial Day weekend. I need to let y'all go because you've been working hard. I know you have, because I have too, and I know y'all work harder than me. So I just want to say thank you to each and every one of you. I want to let everyone out there know everything they told you is from a place of caring, love, and respect. So I really, really want you all to listen to it, heed what they're saying, digest what they're saying, then reach out. Like Dr. Washington said, whether it's to her, whether it's to myself, you all are already on social media and you call my office every day and you know I'll talk to you until your ear fall off. So just reach out to us. We will give you the facts. Get facts. Facts instead of fiction, facts instead of feelings. I respect your feelings, but your feelings will not heal you. Your feelings will not keep you safe. Your feelings may cause you to be like that couple that Dr. Washington just mentioned, like the young lady who was 28 years old who died last week of one of my patients. That was his daughter. All she had to do was get vaccinated, but she didn't want to get vaccinated. Those are the stories we don't want to hear anymore. Okay, we really want our community to be safe, and that's what we want to leave you with is that we care enough about you to take the time to answer whatever question you need so that you're safe. Reach out to us, go somewhere in Memphis to any site, pull up your sleeve, pull up to a site, and then let's pull Memphis back up by getting vaccinated. Y'all be blessed. Y'all have a great weekend and a safe weekend, both driving, flying, doing whatever you all got to do. Okay, much love to you all.
Thank you,
Thanks,
Dr.
everybody.
Lyons.
All right, bye-bye.
Thank y'all.